Good morning, ladies and gentlemen. I'm going to be talking about health like safety because for a long time we weren't addressing occupational health very well. And I've been predominantly working in the construction industry, currently at Battersea Power Station and for the last 9 years next month, working for the Olympic Delivery Authority in London. And what I wanted to do was to, I suppose, act as a bit of a warm-up act for the very distinguished speakers that are going to follow by trying to position occupational health in a way that makes sense and hits three different areas of activity, but does it in a sensible and proportional way. And in a way, I'm going to be making a rather unusual claim. And when you start reading in a few years' time the research work, the evaluations coming out of Thames Tideway Tunnel, the work that's been done on Crossrail being fully evaluated, and the work that we're doing at Battersea, maybe that claim will be a little less ridiculous, which is that a few years ago, occupational health and safety was definitely looking in Western Europe to the oil and gas sector for leadership, for making big changes. The fact that the step change program had that name gave you a sense of that was the sector that was really making waves in health and safety terms. Really where behavioural safety in Western Europe began, all sorts of other developments. But in recent years, I would argue that despite the impression of, from Builder's Bum and, people hanging off scaffold whistling at women walking by and all of that, that actually it's the construction industry that now represents one of the most exciting, innovative, fast-moving, developing areas of occupational health and safety. And in particular, the way that the sector has been taking up the occupational health challenge. And one of the things that happened as a result of the London 2012 programme was the use of an occupational health team and set of services and levels of engagement that resulted in greater worker engagement between management and the workforce than would have been the case without. So the reason why London 2012 was the first Olympic Games development programme without a fatality from an accident was partly because of the way in which the occupational health programme was run. And so we're not talking about occupational health as an altruistic, we're going to do this because we care about our workforce, part of corporate social responsibility, and we can only rely on good employers to recognise their moral obligations. There is a business case for occupational health and a safety case for occupational health, which construction has begun to explore. And that's why the Battersea Power Station development has been taking on some of the lessons from London 2012 and the other great programmes, as I say, like Crossrail. And so when we began the work on demolishing these iconic chimneys, and you can see one of them's quite a bit shorter than the other three, so that work's begun. This is the most recognised real estate development in the world if you take column inches in global newspaper coverage as an index of that. The reason why this programme is addressing occupational health is partly because we don't want people falling from height. And when you engage with a workforce around looking after their own health, it creates the opportunity for a conversation about people looking after themselves and each other, which includes compliance with safety rules and challenging where necessary arrangements that might put safety at risk just as much as it puts health at risk. But why focus on health for other reasons? Well, first of all, I'm supposed to be a health and safety advisor, but for many years, I think our profession operated as safety advisors. And we thought health was something that you subcontracted to nurses and doctors. We thought safety could be managed, but health required health. And it was a bit like that working at height at Battersea. It was as if we did a risk assessment and decided to employ stretcher bearers in order to cope with the necessary attrition that you would get as a result of people working unsafely over the next few years. And yet in occupational health, we often think about the Band-Aid approach to health rather than looking at prevention. And in terms of the numbers, it's overwhelming. I mean, construction is a terrible industry for accidents. I mean, globally, thousands of people die each year. In the UK, we're very proud of the record of reducing serious injuries and fatal accidents in construction. And yet in our industry that employs about 6% of the workforce, we're responsible for 30% of the fatal accidents. So it's a rubbish industry for preventing accidents, and yet something like 30, 40 times as many people have their health significantly damaged and their lives shortened as a result of exposure to risks to their health in the course of their work. And when you think about the reasons why people engage in construction work, Battersea is a regeneration programme for a site that's been derelict for over 30 years. The London 2012 programme was developed precisely because East London needed to be rebalanced with the rest of London, with a regeneration programme that addressed unemployment, poor social outcomes, including health outcomes. And it doesn't make sense to engage in a regeneration programme and ignore the workers that are doing that work and only think that you're going to create social benefits when you've finished. So the sort of communities we want really matter when you're engaged in construction, and it begins with a construction community. And construction employs an aging workforce, and when I talk about migrant workers, this is not meant to be yet another plug for Boris Johnson and UKIP and all the other people talking about the negativities of immigration. It's talking about internal migration as well. If you're a tunneler, you can't wait until a tunnel is being built near where you live. You move to where the work is. Construction is a very mobile migrant industry. So one of the things that we did at the ODA, and I think it's become a signal of an industry with much more confidence about its ability to manage health and safety, is that we stated what we were going to try and achieve. The first publicly funded project to declare, this is bizarre, isn't it, to declare in the UK that it was going to aim not to kill anyone while it was engaged in its work. But if you now look at the way in which Crossrail, Thames Tideway Tunnel, the new nuclear programme at Hinckley, all of the major projects in the UK make very public, clear declarations now of what they're trying to achieve in health and safety terms. And part of the reason for that is those business case arguments that Mark was referring to, that British Safety Council has collated in its recent report, that actually you end up with a better programme of work if you look after the workforce that's engaged in it. And this was the vision statement of our Safety, Health and Environment leadership team, comprising all the great contractors, that it was going to be the healthiest Olympic programme. So we needed a business case to get the money for the Occupational Health Service, and we just made these arguments as to why we needed to do it, and we got the funding, which paid for itself. And the reason why you need to specially argue is that health is seen as difficult. Latency means that people don't feel a sense of day-to-day responsibility. You look after the health of a workforce today, and you don't see the benefits in your work site. Whereas if you prevent accidents today, you see the benefits immediately. And that's, I think, why in construction we've whispered health while we've shouted safety. And our traditional approach, even when we were addressing occupational health, was to employ a nurse and have a nurse on site, and that was going to solve all the problems. A bit of a sticking plaster and a more efficient referral to the local A&E if the injury was more serious. And of course, if you always do what you always did, you know the argument. So what we did, I think, was to help create a model that had been evolving for some time. And this is a busy slide, and I'm not going to spend ages talking through it. But essentially, you need a triple header. You need to think about the kind of medical, clinical, looking after people, pre-placement, screening, minor treatments, all of those things. You need that. But the focus in a workplace should always be preventing more harm. And that's what I mean by health like safety. That you concentrate in safety initially on preventing the fall from height, not just making sure that it's a fall onto a soft surface and that you've got good medical attention afterwards. So it's prevention that is just as necessary as looking at the way in which you're going to treat those people who end up either falling ill or becoming injured or ill as a result of their work. And the wrapper for all of this is a well-being program that links looking at things like, national asthma campaigns. This month, particularly relevant, Stoptober, helping people stop smoking. And that's a fantastic opportunity to talk about respiratory protection, managing dust in the workplace, doing a whole load of other things to look after your lungs, as well as talking about stopping smoking. So you have what we've been used to. You have some clinical services that we all understand, but you need to have, as the meat in the sandwich, you've done a bit of pre-placement screening, you know that you've got a relatively fit and healthy workforce, you identify some health issues for the incoming, and you begin to make sure that they get treated and looked after and cared for, because the workplace is a tremendous venue for rehabilitation and keeping people fit and healthy. But what you then do is make sure that the work they're doing is good, healthy work. You have healthy workplaces that are suitable for healthy work people. And that's traditional occupational hygiene, and you're going to hear about that from Alex Bianchi and other people in the course of today. And you try and make it simple. We used a lot of images, pictures. People are used to health and safety being long, complex, boring procedures that feel more like management covering its rear end. We can always point to the procedure you've breached when it goes wrong, than really acting as guides to an active workforce and their management and supervisors. So we need to think about how we can make health, including prevention of ill health, much easier for people to access and understand, to empower them. And the well-being program, addressing the person holistically and the teams that they work in, creates this big conversation on site that means that health and safety is lifted to a higher plane. Instead of it being people wagging their forefingers at you and talking about rules, it's about you working together collectively to look after each other and look after yourselves. And one of the stories from London 2012 that some of you may have heard before is that when we found we were getting a rash of accidents early morning and serious near misses, we did some research and found that over 70% of our workforce were turning up for work without having breakfast. And low blood sugar is associated with poor concentration. That's why there were those croissants outside before you came in for the first talk. We ran a campaign with porridge, and so some of you will recognise why Ronnie Barker was the image of the campaign. And the result was that many more workers had slow-release carbohydrate breakfast early in the morning, and the accident rate went down. But also, when you feast and famine in the way that you consume food, you end up spiking and troughing your blood sugar. And for people that are predisposed to diabetes, it can push them along that route. So you end up looking after people's well-being, you address safety, and you end up with a more focused, concentrated, efficient workforce. So the target of a healthy worker in a healthy workplace making healthy lifestyle choices makes sense. And what we're doing at Battersea is that we've decided that, like charity, it begins at home but ends with the whole world. We want to build a new community in Battersea, so we're beginning to look at outreach programs using the occupational health resources that we have on site to reach out to the local community. And many of you will be familiar with the campaign in construction around cyclist safety. That's an example, but we're going to do it with health programs as well, with well-man and well-woman clinics being run for local community, making use of facilities that we've got on a construction site. So just to conclude, when Lord Dannatt, then chief of the military in the UK, visited the Olympic Park, this is what he said, that health and safety he'd always thought of as a bit of an obstacle, a millstone round the neck of management, and he found that it was the bedrock of delivering that London 2012 programme on time and within budget. And I think that it was the occupational health programme that we ran that was absolutely at the heart of that. It wasn't an add-on. It wasn't an extra. It was absolutely integrated with the way in which we dealt with risk management. So you need clear targets, you need some techniques and mechanisms, but if you get it right, then occupational health will make a fantastic contribution to every workplace and make for much more efficient working. Thanks very much for your attention.